Welcome to the Humble Hoof podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com. Our last podcast episode, we talked about selenium deficiency in horses. And it's kind of hard to talk about selenium without also talking about vitamin E. I reached out to the amazing group at Mad Barn to see if there was anybody who wanted to discuss vitamin E in horses and how it affects their health and their soundness and movement and even their hooves, and they agreed. Dr. Priska Darani and Dr. Fran Rowe have been on the podcast before talking about all different kinds of aspects of nutrition and how they affect hoof health. And today, we're also joined by Amanda Van Der Kerckhove. She joined Mad Barn last year, and she has been in the Western Canadian feed industry for over 15 years. In this conversation, we talk about the nitty-gritty of vitamin E, what options there are to feed, how to feed it, how horses get it in their diet, and what happens if a horse is deficient, and why it's important that horses get this vitamin. And of course, a special thank you to Mad Barn. You can use code TheHumbleHoof for 5% off your order at madbarn.com. Thank you all so much for being willing to be on the podcast. You know, most of you again, and I really appreciate your expertise and your time to just give us information about these topics. And something that I actually have had come up recently a handful of times in my small hoof rehab world is vitamin E issues in horses, because I actually have a horse on my property that came back slightly low in E, even with supplementation. So I would love to dive into some questions about vitamin E and how it affects horses and, you know, if it affects their hooves or soundness and things like that. Yeah, if you're all willing to kind of chat about that today.
Yeah, absolutely. It's a great topic. And we definitely get lots of questions on our end about vitamin E all the time. So it's sort of an evergreen topic in the horse world, I think.
Yeah, definitely. And so I guess the sort of basics of the conversation is, what role does vitamin E play in the horse's body or health? And why is it an important conversation?
Yeah, so that's a great place to start. Vitamin E is a fat-soluble vitamin, and its main really important role in the body is to act as an antioxidant. So, for example, in muscles, like as the horse is exercising or just in its daily life, it's going to produce these things called free radicals, which can damage different parts of the cell. And so vitamin E is there to protect like cell membranes from those molecules that can be damaging. So it neutralizes those. And so that's important for muscle, but also nerve cells, cells of the immune system, reproductive health, kind of all cells of the body. It's going to be important for protecting the fatty structures in the cells. And so horses will normally get their vitamin E from pasture, but then if you have horses that are on more hay, that's when you're going to see maybe that their intake is not quite high enough. And so there you might start to see horses becoming deficient in vitamin E.
Yeah, and is that a fairly common deficiency that you see? And, you know, what are some symptoms that you might see if a horse has a vitamin E deficiency?
Yeah. So I do think I would say it is probably a fairly common thing, at least for people approaching us or owners approaching us with concerns, or, you know, having blood work done and then, you know, finding out their horse is testing low. And so coming to us to, you know, look at the diet, rebalance the diet, you know, what needs to change to fix that. And so when we talk about vitamin E deficiency, there are, you know, as Dr. Darani said, you know, it's fundamentally a disease of oxidative injury and kind of cumulative oxidative injury in the body. And so when vitamin E is insufficient and that antioxidant defense is diminished, you know, free radicals, these damaging little molecules that just are produced naturally in the body, that can lead to more cell death and cell damage and cell death. And so, you know, in the tissues most affected there, by this free radical or oxidative damage is going to be tissues that are really highly metabolically active or really long-lived cells that don't necessarily regenerate very well. So they're just at risk for, for damage. And so that's why we commonly see vitamin E, or when we think about vitamin E deficiency, we think of it as this kind of neuromuscular disorder. So, and the clinical signs are going to follow that. So there are three kind of neuromuscular disorders in horses that are caused by vitamin E deficiency. We've got kind of this spectrum of disease. The terminology gets a little confusing, but there's the spectrum of disease that is the equine neuroaxonal dystrophy to degenerative myelencephalopathy. We've got equine motor neuron disease, and then there's vitamin E responsive myopathy. And so, again, the clinical signs that are going to be, how these horses present, it's going to depend on where that oxidative damage is primarily occurring in the body. But in general, we're thinking some degree of like neurologic deficit. So, these horses might present with ataxia or incoordination, weakness, abnormal limb placement or tripping, muscle fasciculations, muscle atrophy. Sometimes it can be really subtle. It can just be like poor performance or exercise intolerance. And then sometimes changes in attitude. Owners might notice kind of notably kind of the two spectrums in behavior, either kind of this dull or almost like sedate type of demeanor, all the way kind of to the other end of the extreme being kind of explosive, unpredictable type behaviors. And so the onset of those can be really insidious and really low grade. And so it can sometimes be hard for owners to pick up on that kind of early on or notice those really subtle changes that are occurring early in that deficiency type process.
And is that something where, for diagnosis, as far as I know, it's a blood test, right? Like that's basically what you're doing. And is that something where owners should be just testing that regularly just to kind of check levels?
Not necessarily, no. So we'll talk probably, I'm sure we'll get to talking about kind of a little bit more of like where vitamin E naturally comes in, or where horses get their vitamin E in the diet. And, for most horses on a well-balanced diet, they get plenty of vitamin E. So it's not necessarily that we need to be screening horses all the time for deficiency. Though it is easy to do, right? It is just a blood test, so it's not like some invasive procedure that's difficult, but really I think testing, it's a tool that comes in when you've got horses that maybe are dealing with something wrong, right? They're showing some type of clinical disease, whether it's neurologic or it could be, you're doing a workup for a horse that has kind of just poor performance that's kind of vague or something like that. So it's an easy kind of box to check and rule in or out. But yeah, I would say at present there's not really a need to be screening healthy horses for vitamin E. I think it really just is it's a diagnostic tool that we have if we have concerns or think that could be playing a role in however that horse is presenting for whatever issue the owner's concerned about.
Yeah, definitely. And probably the veterinarian would be a good resource to ask.
100%. Yeah. 100%.
And you had mentioned diet. And so what are some typical dietary sources of vitamin E? Because I know that, I've always heard that it's not very stable or found in dried hay very well, right?
Yeah, that's right. So the best source of vitamin E is actually going to be your fresh green growing pastures. Those plants are going to have some of the best sources and most bioavailable sources. Vitamin E will oxidize after that grass has been cut down for hay. So you're not going to have nearly as much in your dried hays. And we typically assume a value of 0 when we're balancing diet on hay-only diets. So in that case, we would want to look at some supplemental forms. Most of your well-formulated vitamin mineral balancers are going to have good levels of vitamin E. There are some oils out there that might have a bit of natural component as well, but unless they're well fortified, I wouldn't be relying on those as your primary vitamin E sources. I think we're probably going to get into the different types of vitamin E, the synthetics versus the natural. Maybe Fran can speak to those.
Yeah, actually, you had mentioned natural E, and I've always sought out supplements that mention having natural E as a component, an ingredient. And it was all because, I took a course with Dr. Kellen years ago, and I had read, now I could be totally wrong, so I want you to correct me on this. Something like, synthetic E, you might need to feed like 2 to 3 times the amount of synthetic E to get the same bioavailability. Is that totally off? Or is there some sort of like ratio of how much is absorbed in the body based on synthetic versus natural sources?
That's a good question. I don't know if I have a number right off the top of my head as far as like you need, X amount of natural E is equivalent to Y amount of synthetic E. But generally speaking, if the other ladies do have a number off the top of their head, they can jump in. But yes, in general, you're absolutely right. We do recognize that there is a significant difference in the bioavailability of these two different forms of vitamin E. And so in general, sure, you will need potentially more synthetic vitamin E to kind of get that equivalent efficacy, I suppose, to when you're comparing it to a natural source. But we can definitely kind of back up a little bit and talk about the difference between synthetic versus natural, because it's a big piece of the vitamin E conversation for sure.
Yeah.
And so, yeah, so the nomenclature surrounding vitamin E, this will get a little into the nitty-gritty, but I think it's good because there's kind of some different terminology that gets thrown around, and I think without it being explained, it gets really confusing. So we can kind of start from the beginning, but the nomenclature in terms of when we say natural versus synthetic, it's not just tied to marketing for a supplement or a product. It actually comes down to the actual chemistry of the vitamin E. So when we talk about vitamin E is actually an umbrella term that refers to a family of compounds made up of 4 types of tocopherols and 4 types of tocotrienols. The most biologically relevant form of vitamin E is alpha tocopherol. And so when we just in daily life or in the context of equine nutrition, when we talk about vitamin E, or even in this podcast, we say vitamin E, we're really referring to alpha tocopherol. And so that's kind of distinction number 1, is there's a lot of different vitamin E compounds, but really what's relevant for us in equine nutrition is this alpha tocopherol. So the difference between natural and synthetic alpha tocopherol comes down to the kind of spatial arrangement of that molecule. This is called stereochemistry. That's getting into the weeds of kind of organic and biochemistry a bit, but essentially there's 2 possible spatial arrangements of the alpha tocopherol molecule, and those are called stereoisomers. And so we've got D alpha tocopherol, which is natural, and then we have DL alpha tocopherol, which is synthetic. And there is a bit more of an updated kind of naming system or nomenclature now that I think is at least in research or kind of in more kind of contemporary biochemistry is used more, and owners might start running into that naming system as companies potentially start adopting the new nomenclature. So just for clarity, that natural vitamin E D alpha tocopherol is synonymous with RRR or triple R alpha tocopherol. And then synthetic vitamin E is DL alpha tocopherol, is synonymous with this all rack alpha tocopherol, or a racemic mixture of all stereoisomers of alpha tocopherol. So I know that's really confusing. There's a lot of different names and nomenclature. So that's kind of background on that. And then why does natural versus synthetic really matter? So plants produce vitamin E, alpha tocopherol, in a very specific configuration, that is the D or triple R alpha tocopherol stereoisomer. And so that's what the horse's body has evolved to utilize. And that's going to be the form of vitamin E that's most bioavailable in the form that's preferentially recognized and retained by cells in the body. In contrast, synthetic vitamin E is what's produced, is what's man-made. It's produced chemically, kind of via chemical synthesis and manufacturing. And in that manufacturing process, we can't selectively produce just the natural configuration, that D or triple R configuration. And so we actually end up with a mixture of stereoisomers, which is where that terminology all-rac or racemic mixture comes from. So we'll have 8 stereoisomers. One of them is the natural form. And then the rest are just the other spatial arrangements or other stereoisomers in that mixture. And so the key takeaway really is that the natural vitamin E, our D or triple R alpha tocopherol, is more bioavailable and retain longer in tissues compared to the other stereoisomers that make up synthetic versions of vitamin E. Now, that doesn't mean synthetic forms are useless. The body can still use these other stereoisomers, but just potentially less efficiently. And we kind of know that the synthetic versions have that lower potency, kind of reduced tissue retention and lower bioavailability. But that might be okay for horses who have normal vitamin E levels anyway, and they, and it can still be useful for kind of maintenance supplementation, but definitely for our deficient or high-risk horses, that natural vitamin E is going to be the preferred form to feed or to supplement.
Yeah.
That was long-winded.
No,
so.
it makes total sense. And I really appreciate hearing more of like the nitty-gritty of how each form is sort of working in the body and what that means for the horse. And it's interesting because there's, that's like step one, I feel like, in my brain of like, okay, synthetic versus natural. But then you go to the store, right, to try to, or online to try to find an option. And then there's a million other options, even within, like, if you're just looking for natural. Yep. There's like the powder supplements, there's the liquid supplements, there's some that are in some kind of like oil suspension, there's some that are like water soluble. And then it's this whole other, level of like, okay, what do I do now? So, as there, if we're looking at natural forms and they still have all these options, how do people parse out what is good for their horse? Or are all of them comparable? What does that look like?
Yeah, so you're right. There is a ton of options. And really what you're going to choose comes down to like the needs of your horse and also kind of how long you want to have them on a specific type. So the reason why they exist in different forms, like, for example, the fat-soluble form of vitamin E or the fat-based, is because when vitamin E is fed to a horse, it first has to be put into like a micellar structure in the intestine, which just means it's packaged along with like fats and bile salts, and that helps it get absorbed because it's naturally fat-soluble. And so it's not going to mix well with the intestinal fluids unless it's packaged into this structure. And so that's why we often say, vitamin E is going to get absorbed better when there's more fat in the diet, or at least like minimal amount of fat is provided. There's enough to package it and get it absorbed. So that's where the fat-based natural vitamin E helps get that vitamin E absorbed across the intestinal wall. The other options like water soluble, those sources are already provided in a micellar structure. So the vitamin E is kind of not fat soluble anymore. It's water soluble because it's packaged in this micellar structure. And so that lets it get absorbed faster. And so if you have a horse with like clinical signs where you really want to see that get improved quickly, you're probably going to want to go with water soluble just because you're going to see it get absorbed a lot faster, levels in blood get improved faster. It also reaches the spinal fluid. And so for those horses that are really showing symptoms, you'll probably want to do water soluble. It is more expensive. And so for a lot of people, you're not wanting to keep them on water soluble long term. And so you can transition them to powdered or pelleted natural vitamin E. Or if your horse isn't showing symptoms or it's just, you're just wanting to give vitamin E, then the powdered pelleted vitamin E is perfectly fine. And it's more economical. It's probably what you're going to want to supplement long term. So that's why there's kind of those different options out there. And really what you want to pick is based on like your budget and also your concerns for your horse.
Yeah, and do you worry at all about like a powder form versus a liquid? Like, is the powder not going to be as stable, or is it, is there a difference there too?
So the powder form is usually alpha tocopherol acetate. So the acetate is added on to help with the shelf life of the molecule because, otherwise alpha tocopherol does oxidize quickly. But with that acetate on there, it's a stable molecule. So there's not really that concern with the powdered or pelleted forms.
Oh, that's good to know. Okay. And that one, I mean, typically, I guess if it's a powder, it's not going to have, I mean, I could be wrong, but it's not going to have like a fat. Like you'd have to feed a separate fat with it usually.
I mean, not necessarily. Like horses will get some fat from their forages. Probably if you're feeding a grain, there's going to be some oils in there. So it's not necessarily that you have to always feed an additional fat source when you're feeding vitamin E. If you're going to go to high levels of vitamin E, or then maybe you'll want to add more fat, but typically it's okay.
Okay, yeah. And I guess that's, sort of that leads into the other question of, I mean, really you answered it about how much fat are we feeding these horses in order for the E to be utilized or absorbed?
Yeah, so with Priska said that, there is fat that is going to be present in the natural diet of a horse. Forages do contain levels of fat that range anywhere from maybe 1.5% to as much as approaching 5% if it's that fresh green growing pasture. If you have concerns about the status of your horse, or if you just want to provide a bit of a insurance factor, adding a splash of fat or oil can certainly be helpful. Just because, as we've mentioned, that vitamin E is a fat-soluble vitamin. So its absorption really does depend on the digestion and absorption process of the fat in the diet. So adding a little extra can just be that insurance or that safety net for supporting absorption.
Yeah, and that makes sense. And so, the reason that I've been so interested in this, I mean, obviously because I'm interested in anything that can affect soundness and hooves especially, but like I mentioned at the start of this episode, there's this horse at my property who has been getting, for 2 years since he's been here, a water-soluble form of vitamin E like I give to everybody here, and has been getting more than what, the NRC recommends, and his levels came back borderline low. And they're still in range, but it's just concerning to me that he's been getting so much. And he does also actually graze here in the summer as well, and that they're not as high as I would expect them to be. What kind of factors, do different horses just as an individual absorb E differently? Are there certain conditions where you say like horses will absolutely need more E than another horse? Or what kind of factors can affect that case by case?
Yeah, that's a really good question, and I think something that certainly adds sort of that gray zone factor to, talking about supplementing vitamin E or interpreting any type of blood work, right? We mentioned earlier that, we test for vitamin E via blood work. It's a serum. It's tested in the serum. And overall, we think that it is a good test in terms of kind of it's fairly reliable in reflecting the horse's current vitamin E status. So we have a good amount of confidence in the test itself. But just like any diagnostic tool, nothing's perfect. It's not foolproof. So, it always has to be interpreted like in the context of of the horse in front of you. And like you said, Alicia, like, your question here of like, is this just a unique thing to this horse in terms of is there individual variation in a horse's, absorption or utilization of vitamin E? And I think the short answer is yes. We certainly assume that individual variation is a big driving factor in why we sometimes, test otherwise clinically normal horses. Like they just get the blood work done and they test low, and then they're supplemented and then they still test low, or or they just don't kind of follow the book on like what we would expect. And I think that's a good example of probably there is some individual, variation in that horse's ability to either absorb the vitamin E or utilize it efficiently, like post absorption. And it probably comes down to genetics, and certainly, just because the horse or your horse in this example is testing low, despite high levels of supplementation, doesn't mean that they're going to be destined to develop disease, but it's or clinical disease, for example. So that certainly is where we kind of have to take it all with a grain of salt and really, put the whole clinical picture together and deciding, kind of how we supplement, with what products we supplement, the levels, and that's where like working with your primary vet really is going to be so important, because they're going to really be able to help like guide you and work with the horse in front of you, so to speak. But aside from this idea of individual variation or a genetic component to differences in absorption or utilization of vitamin E, there are certainly other factors that can influence vitamin E status. A good one is anything that's going to cause increased oxidative stress in that animal, right? Because of vitamin E's antioxidant role. Anything like some type of concurrent illness or systemic inflammation, recovery from injury, or even horses that are in more high intensity exercise are going to be kind of in a kind of more higher oxidative state. And so they certainly may have a higher requirement for vitamin E and or benefit from extra supplementation to kind of combat that oxidative stress. Kind of the animals, what we call their physiological state can matter, or certainly kind of infers what their vitamin E requirement will be. So that includes things like workload, whether, a horse at maintenance is going to have a lower vitamin E requirement than a horse in heavy exercise, but also age. So, growing horses versus mature horses, and certainly like reproductive status, like if it's a pregnant or lactating mare, for example, there will be differences in kind of vitamin E, baseline vitamin E requirement for that animal. And then we've already kind of touched on diet, but that's still a big component of or a big factor that can influence vitamin E levels. So, diets that maybe have limited or no pasture access, if it's a hay only diet, or, a metabolic horse that, can't safely be out on pasture, we're certainly going to pay a little bit closer attention to like where are we getting vitamin E otherwise in the diet. And then, we've touched on kind of the form of vitamin E supplied in the diet, if it's a natural form that's more bioavailable versus, the synthetic forms that we know are a little bit less bioavailable. And so I think just in general, a horse's status can there's a lot of it's very multifactorial, and that I think that is hard to kind of wrap our brains around, because we want it to be a very black and white answer sometimes, and we want them to test low, we supplement them, and then they test high, and then all is right with the world, and sometimes it's just not as clear cut as that. So
yeah, and actually I'm thinking of a case that unfortunately was euthanized. This was years ago, who had equine motor neuron disease, and just was like, the owner just could not get his vitamin E levels up no matter what they did. And his body was literally wasting away. I had never seen anything like it. It's like he was, literally eating his own muscle. Like his body was just absorbing his muscle at like an alarming rate. And that was really sad. So yeah.
Yeah. Well, one of the things that, makes vitamin E so important in the context of disease, I suppose, is that, certainly prevention is much preferable to treatment of clinical disease, because when a horse does cross the threshold into becoming clinically vitamin E deficient is what I mean, because we can have horses that are subclinical, meaning they test low, but they're otherwise totally normal. But when they become clinical, they start developing these neurologic deficits, et cetera. That oxidative damage that happens to the nervous system is irreversible. And so even with supplementation, a lot of those horses won't improve with supplementation. At best, they'll stabilize, but there certainly is a large percent of horses that even with supplementation will continue to decline. And so, that's why vitamin E is really important and why we care about making sure that it is, that these horses are getting a balanced diet all through life so that we can kind of prevent the clinical disease from developing.
Yeah, that makes sense. Yeah, I mean, this has been super helpful and informative. And, is there anything that we didn't cover that's important to talk about, or any last minute advice for owners in regards to nutrition or vitamin E supplementation?
I guess from my perspective, just to continue on with what Fran was saying too, is vitamin E is important, but it's just one part of a well-balanced diet. And when I kind of bring things back into more of a practical nutrition and ration balancing perspective, making sure that you've got sufficient vitamin E in the diet alongside all those other essential vitamins and minerals, which often also have antioxidant roles in the body. So I tend to not think about vitamins and minerals and their individual components. Like, there are no superheroes. That's the totality and the balance and sort of how they all work in concert that I like to think of sort of on that day-to-day basis. And just making sure you're providing that well-balanced diet can go a long way to keeping your horse happy and healthy in the long term.
Yeah, absolutely. Great. Well, thank you so much. I so appreciate your time. I know that you guys are all, I'm sure, super busy, and I really love talking to you all and learning more and being able to get this information out there. I think it's going to be so helpful for owners, and I would love to, continue to have calls with you guys about questions in regards to nutrition or, anything else that you feel might be helpful for horse owners to hear more about.
Yeah, absolutely. Well, we're always happy to join you, Alicia, on the podcast, and thanks for having us on this talk. It's a good one, and we certainly talk about it a lot just in our daily lives. So from our side of things. So,
well, definitely, you're welcome anytime.
Perfect. Well, thank you, Alicia.
Yeah, of course. Have a great weekend.
Yeah, you too. Thanks.
Bye.
Bye.
I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.